It is 5:30 and I'd like to call the October Human Services meeting to order, please. At this point, Kathy, I think the entire committee is here with the exception of Supervisor Nordigian, who's excused. Okay, so we're good with that. Okay, let's move on. Are there any citizen comments? If there are any citizens here who would like to make a comment, they need to come up to the microphone up there and they can have an opportunity to speak. Are there any citizen comments? I see lots of citizens. No? Okay. If not, we'll move on. Citizens' comments are closed. I don't have any particular comments now for this meeting. Do any of the supervisors have anything they'd like to say before we get started on the meeting? No? Okay, that's good. So let's move on. The next item on the agenda is the approval of the September minutes. Has everyone had a chance to look over the minutes? Does everything look good? Are there any corrections or amendments that you'd like to make? Okay, we have a motion to approve by Supervisor Robinson. Do I hear a second?
Second.
Second by Supervisor Poole. And we have two of our YIG students here. How do you vote on the approval of the minutes from September? Aye. Committee? Aye. Okay, minutes are carried. All right, let's move on to the first resolution on the agenda, the resolution to approve Stephanie Connolly to the Human Services Board. Ms. Connolly is here. I just spoke to her. She's sitting over there. Do any of you have any comments or any questions for Ms. Connolly? And did you get an opportunity to look at the application? Okay. No questions? Yes, Supervisor Nudo. This is not a reappointment. This is a initial appointment. So, if I don't have any either. Okay, well, you don't need to come up if we don't have any questions. So as far as I'm concerned, you're okay. Is there a motion to approve her appointment?
Move to approve.
Okay, we have a motion by Supervisor Kirby. Do I have a second? Second by Supervisor Nez. YIG students, how do you vote? Aye. Committee? Aye. Your appointment carries. As I said, next step is the county board next month for the final vote. Okay, so you can ask, I don't know what date that is, but sometime in November, November's 4th, November 4th at 7:30 p.m. You need to be there for the final vote. Okay. All right. Okay, let's move on. Next, we have a resolution to approve the reappointment of Charles Burmeister to serve on the Kenosha County Veterans Service Commission. Is Mr. Burmeister here? No. Okay. Any questions or discussion on Mr. Burmeister's appointment or reappointment in this case? No?
Move to approve.
Okay. Who had a hand up? Oh, Supervisor Nudo. That is a good question. I'd have to look that up. What does it say on the application?
31st day of December 2028.
No, when is it up now?
Oh,
When does it expire now? Does it say?
no, but it's a 3-year term. So it would be December 31st.
So presumably December 31st, it gets renewed for another 3-year period. So, yeah. Okay. No questions? Do I have a motion? Oh, you made a motion, didn't you, Supervisor Robinson? Okay, Supervisor. Your turn now. Okay, Supervisor Brown, do I have a second? Second by Supervisor Robinson. YIG students? Aye. Committee? Aye. Motion carries. All right, next we have a resolution to approve the reappointment of Donald Deal to serve on the Kenosha County Veterans Service Commission. Yeah, is Mr. Deal here? No? Okay. Any questions or comments? None? Motion to approve, Supervisor Poole. Do I have a second? Second by Supervisor Brown. YIG students? Committee? Aye. Motion carries. Let's see here. Resolution to approve the reappointment of Julie, I think that's Bayless, to serve on the Kenosha County Commission on Aging and Disability. Any questions or comments? Committee? Yes. Oh, that's you. Move to approve. Motion, okay. A motion to approve by Supervisor Kirby. Is there a second? Second by Supervisor Poole. YIG students, how do you vote? Committee? Aye. Motion carries. Next, there's a resolution to approve the reappointment of Constance Carr to serve on the Kenosha County Human Services Board. And Ms. Carr is sitting right over there. So if we have any questions, we don't have to look too far. Any questions for Ms. Carr? None? Do I have a motion to approve?
To approve.
Okay. Okay, Supervisor Poole and a second by Supervisor Nez. YIG students? Committee? Aye. Motion carries. You are reappointed, contingent upon the county board vote. Yeah, you're welcome. All right. We are at adjournment. That's what you call an efficient
Motion
meeting.
to adjourn.
Yes, motion to adjourn. Do I have a second? Second by Supervisor. Flip a coin. Okay. Supervisor Robinson or Brown. YIG students? Committee? Aye. Okay, we are adjourned. Now, since this was only a 7-minute meeting, but the next meeting starts officially at 6 o'clock. I don't think we can start.
It says at the conclusion of the first meeting, so there isn't a 6 o'clock time. It says after the conclusion of the first meeting, we'll go immediately into the budget hearing.
I like that. Even better. Why waste time? Okay. Now, hopefully, the only thing is we don't have 2 Human Services Board members here, and I'm wondering if they were waiting for, assuming that we were going to start at 6, Gashke and Gama, but okay. Oh, well. Well, let me get my stuff out here because I have to do a little adjusting and then we can start. Let's see. We can do the roll here. Oh, wait. We have the resolutions here. We need to sign these. So I'll pass these around for the appointments. There are 3, 4, 5 of them here. Pass them down. You can start from the end and go hand them over. All right, let's see. Let me get my agenda out. Okay, let's see. This it's ready here. All right. It's the agenda. All right, a call to order. It is 5:39. Call to order the Human Services Committee budget meeting. We have Supervisor Franco present, Kirby present, Brown present, Nez present, Nordigian excused, Poole present, and Robinson present. And both students still here? Present and present. Okay. The Human Services Board, we have, at least at this moment, let's see, Richard Willoughby, Constance Carr, James Hall, and that's it, right? Supervisors Gama and Gashke are not here at the moment. Oh, I'm sorry, yeah, and Supervisor Kirby, that's right. Okay, let me just say a few words here. Chairman's comments before we get into citizens' comments and begin the program. I'd like to welcome everyone to the 2026 Human Services Budget Meeting. I'd like to recognize the Human Services Board, all services, Human Services directors and employees, as well as all other guests and interested parties. Tonight, we will be reviewing all of the divisional budgets prepared by Tammy Capito and her team. I'd like to recognize all the hard work and time the finance team spends in producing a budget of this size every year. Thank you for that. As the biggest part of the county executive's overall budget, Kenosha County Human Services provides care to our elderly population in need of nursing care or assisted living, to giving support to children, youth, and families in need of aid, to job training and economic support for the disadvantaged, to contracting with nonprofits who help the aging and disabled population, to addressing the prevention, intervention, treatment of behavioral health issues. And this is just to name a few necessary and significant services that the Human Services provides to Kenosha County. I'd also like to thank John Jansen and Rebecca Dutter for their ongoing leadership, as well as Kathy Duberstein for her organization and reliable reminders, which keep me informed at all times. Lastly, I'd like to recognize the Human Services Department for their generosity in supplying the food for this evening. Thank you very much. Okay, so tonight we will review each divisional budget and then vote on them separately. Committee and board members can ask questions during or after each divisional budget is presented. After all information is presented and all questions answered, then we will vote to approve the respective budgets or not. If any amendments are presented, they must be moved and seconded before any discussion can ensue. With that in mind, let's begin. Okay. Are there any citizen comments? Actually, that's the next thing in line. Any citizen comments? Any citizen comments? Doesn't look like it. Okay, citizen comments are closed. So let's begin with the budget. Tammy, you have the floor. You may begin.
All right, I'd like to thank everybody for their support of Human Services tonight. I'm very excited to bring forth the 2026 budget. We will start on the summary page. We are looking for a levy decrease of just under 1.4 million or 6.33%. Our county FTEs are increasing by 4.9, and our personnel increase is just a little over $1 million. Brookside and Willowbrook are adding to the reserves, 1.8 million. Our funding by funding source, our levy has gone down from 19.48% to 18%. With this budget, you will see we do have the new building for 2026, so we have budgeted for half a year of that. There is a total building cost increase of just under $500,000 included in this budget. Public liability insurance that comes from finance has gone down. There is a decrease of just under $100,000 in this budget for that. There is a 2% wage scale increase that equated to $105,000 in this budget. There was a medical insurance increase. With all medical insurance, we had an increase of $295,000.
Tammy, are you still on page 1?
That was a page I don't have included, and now I'm going to start with Brookside.
I wasn't following you on that. That's probably the reason. So are you moved? Any questions on page 1 or anything that you
Just
said?
about what you talked about,
Yeah.
Tammy. What was the percentage of the increase on the health?
The health, was a 1% increase to the divisions.
Thank you.
Other questions on page one? One of the things I noticed, which I thought was interesting, the numbers in relation to the other sources, in terms of funding sources, that federal spending was down a bit, no surprise there. But state funding was up. So that was good to see. But it wasn't unexpected, that's for sure. So, yeah. Any other questions? No? Okay, please move on.
Okay, so we will start with Brookside Nursing Home. So the big thing to notice here, Brookside is in its own proprietary fund. And this year, we do have a levy give back of 500,000 included in the 2026 budget. There are a couple of FTE changes for Brookside. We do have the director of nursing retiring, so we have some succession planning in there for her. That is 27,000. The medical records supervisor, she also is retiring. We have succession planning for 17,000. Those numbers, just so you know, are on the wrong line, but they're flip-flopped. We have increased for a 1.0 compliance and education nurse, 108,000. We have increased for a resident services manager, 1.0, 127,000. We have the LPNs are in a pay grade up class from a NE9 to an NE10. And we have included holiday pay for the pooled employees. In this budget, we have budgeted a census of 144, up from 136 in 2025. We do have two other positions that were added in the 2024 budget resolution with a census increase. That was a 1.0 for a maintenance tech and a 1.0 for an environmental services worker. With this budget, we are adding to the reserves and just under 1.8 million with giving the $500,000 back to the levy. And this will turn their negative balance into an estimated positive balance with Willowbrook of 450,000.
Can you explain, I was going to ask you that anyway, the 500,000 give back to the levy, what exactly do you mean by that?
So that means a portion of their revenues will go back to the general fund, 500,000.
Okay, so you're transferring the money to the general fund from the levy. So it's a give back to us, but to a different fund?
It's coming out of Brookside's revenue and going into the general fund.
Okay. All right. Thank you.
This budget was,
Oh.
go ahead.
Sorry.
Sorry.
Go ahead.
I have a quick question about the director of nursing retirement, or sorry, the medical records. Sorry. The positions that are added, the compliance and education coordinator and the resident services manager, is that assuming 6 months in this budget, or is it assuming they'll be here the full year?
Those are both in for the full year.
Okay.
Continue.
This budget was approved unanimously by the Board of Trustees on October 13th, 2025. And that was everything that I had to talk about. So if anybody has any questions on anything on Brookside.
Any follow-up questions?
I
Yes.
just, because they're in their own, whatever you call that,
Proprietary fund.
proprietary fund, those 4 point, sorry. Going back to the, and I can't see, John, 4.9 new FTEs were those Are those counted in here, or, I mean, is that across all of human services, or is it gonna be 4.9 later? And I'm gonna have to keep track of that these that you just mentioned aren't in here, aren't in there. Because it's in their own proprietary.
The
fund.
4.9 is for all of human services. The 4.0 is Brookside specific.
So there's 0.9 somewhere else.
There's adds and subtractions.
Perfect.
Yes,
All right,
elsewhere.
Thank you.
What, other questions, Supervisor? Okay, continue.
Second.
Oh, do you have a question?
Yeah, just on point 3 on the printout, page 2, the, your goal of sustaining and maintaining financial independence. Are the numbers for the Medicare daily rate flip-flopped? Because it's got the Medicare daily rate going down, or did they actually lower the Medicare rate?
We did lower the Medicaid rate. If you look on page 3,
Medicare,
yes, the Medicare, correct. We were trending, it's a fluctuation on what we get paid. So based on at the time, what our revenue was, we brought it down based on where our actuals was.
excellent. All right, thank you. Just wanted to make sure.
Okay, continue.
That was everything for Brookside, unless we have other questions.
Didn't the Medicaid, rate go up this year considerably?
So our Medicaid rate is, Medicaid is now fully funding the cost of care. And in 2025, we budgeted $420 per day. 2026, we have in the budget $480 per day. So that's an additional $60 per day.
Right. And also, looking at the numbers here, what else went up? Yeah, that's true. Yeah. Well, that's good. Okay, great. Okay. Oh, yes, we do. Any other questions? For, Brookside? Any other questions, comments? Okay,
Motion.
do I have a motion to approve by Supervisor Brown, second by Supervisor Robinson? YIG students? Aye. Committee? Aye. Okay, motion carries. Thank you. Oh, I'm sorry. Human Services Board, my apologies. How do you vote? Aye? Okay, thank you. And Andres, let the record show that Supervisor Gama is now here, Kathy. All right. Move on to Willowbrook.
Page 5 starts with Willowbrook Assisted Living. This is our 24-bed facility. In this budget, we have adding to the reserves $120,000. The big items in here is the reduction of the Willowbrook manager, so a negative 1.0. And the addition in Brookside Care Center of the resident services manager. That position will also have oversight over Willowbrook in lieu of the Willowbrook manager. We did not have a revenue increase, rate increase for the residents. Last year, we did do a 7% for 2025, and we left it the same. We do have an increase of 65,000 in revenue, and that's really just due to the payer mix. We've got different levels of care, and it's just based on actuals on where our level of care is. This budget was approved by the Board of Trustees as well on October 13th, 2025, and I will entertain any questions.
Where does that 120,000 come from?
So,
Reserve, to go
yep.
to reserve?
So the revenue is a little over 2 million. The expenses is a little under 2 million, bonding of 20,000, and then the rest is profit. So 120,000 will go into the reserve account.
Okay, thank you. Any questions? Anybody? Good. Good.
Move to approve?
Okay, we have a motion on the floor. Do I have a second? Second. YIG students, how do you vote? All right, committee, aye. Human Services Board, how do you vote? Aye, okay. Oh, oh, all right, yeah. We're gonna hear.
I know.
Okay, a motion carries. Let's continue on.
All right, the next division is Office of the Director, starts on page 6. In this division, we are looking for a levy increase of 107,000 or 12.4%. Staff and recruitment increases is 56,000. 26,000 for medical insurance coverage and 26,000 for the normal 3% increase. So, the 2% is the whole wage scale, meaning the minimum, mid, and max. The 3% is what the employees get, 3% of midpoint if their annual is good. And then the other big item in this one is the building rent. So the increase for the 6 months of the new building is an increase of just under 32,000. And then any questions on Office of the Director?
Any questions? None? Do I have a motion?
Move to approve.
Okay, that's a first by Supervisor Nez. Do I have a second? Second by Supervisor Brown. YIG students, how vote you? Committee? Aye. Human Services Board, how do you vote? Aye. Okay, resolution passes.
Right, the next division we have is the Division of Children and Family Services. That starts on page 7. We are looking for a levy decrease of 558,000 or 5.04%. There is an FTE increase of 0.5. That is on a position that was approved in 2025 that started at a half year. So this is the other half of that position. In this budget, we have comprehensive community services that is fully funded. And historically, we have only budgeted the service facilitation portion of this program. We have included the provider services in here because we do pay them and we get revenue. So that's why you're seeing those big swings of an increase of revenue of 4 million and an increase in expense of 3 million. We have court-ordered placements, a reduction of just under 1.3 million. And we'll look at that page after I finish with this page first. We have a few program changes, positive parenting grant that ended, 137,000. Families First grant that ended, a reduction of just under 69,000. And Brighter Futures grant at the time we thought ended 195,000. The next page 8 is our out-of-home placements for children. So as you can see on here, 2025 we budgeted 12.5 million, and for 2026 we're budgeting a little over 11 million.
Mhm.
Yep.
I was just gonna say, that was good to see. The placement rates have gone down, and a couple of them are really make a big difference. You're talking almost, what, $1.5 million difference there.
Yeah.
So that's really good.
So, one of the big ones that happened was with the state budget, the corrections rate went from 1,300 a day. At the time I put 750 a day, but it's like 500 and something a day.
It's even lower. Wow.
Yes.
Okay.
And they're on a state calendar year, so it'll be a partial 26. It'll go up July 1st.
What's your take as to why it dropped so exorbitantly? I mean, that is a huge drop. Is there a
I
reason
believe
for
that they, when the governor, took his pen to the bill that was passed, he heard loud and clear from counties that
Ah.
we couldn't afford what would have been about a $2,700 bill per day
Oh,
per kid. So he just X'd out the two and left it at the 750 and 550 for this year. So
Yeah.
that's really what drove that change.
wow, yeah. Yeah, thank you.
The other changes in here, so the number of kids has increased from an average of 261 to 286. 35 of those are in the foster care. And that's an increase of 319,000. The long-term detention, we decreased from 7 kids to 2 kids. That was a decrease of just under 1.2 million. And then we have the Racine facility. We are contracted beds. We have contracted beds with them at 1,100. And we increased the beds or the children in there from 2 to 3.5. And that makes up the majority of the placements changes.
Tammy, what's the comprehensive community services?
So that's
What entail?
behavioral health services for children.
Oh, okay.
And the federal government pays 60% and then the state covers the match of the 40%.
You know, I noticed one other thing too, and I suppose I can ask it now. The rent for the new human services building is all over the place. I don't understand why. What I mean by that is like for one subdivision, they charge 30,000, another 166,000 for 6-month rent, another 80,000 and another 60. Is it all having to do with logistics, like space and that sort of thing, or?
Some of the
much?
directors wanted gold floors and some didn't.
Ah, the truth comes out. Okay.
Yeah, it's all space related.
Yeah.
So however much square footage, everybody's seen an increase of cost per square footage, but some took more square footage and
Okay. And they know that gold is trading at $4,500 an ounce, right? Okay, just checking. Okay. All right, that makes sense. Or explains it anyway. Thank you.
any other questions on children and families?
Any other questions? No? Okay, do I have a motion to approve? Move to approve by Supervisor Robinson. Do I hear a second? Second by Supervisor Brown. YIG students, how do you vote? Committee? Aye. Human Services Board, how do you vote? Aye. Okay, motion carries. Thank you.
All right, the next division is our Division of Workforce Development. Starts on page 9. We are looking for a levy increase of 195,000 or 17.2%. In the staffing, we did request a 1.0 for an economic support lead trainer, an E9. Currently, we do have this position. It's contracted in half Racine County, so this would make it a full-time. And it was about a $25,000 cost to the levy because we do have funding to draw down with that as well. For funding changes, the WIOA Workforce Innovation Opportunity Grant, we brought down revenue and expenses closer to where we are trending. So you'll see decreases both in the revenue and expense of a little over $500,000. Same with Windows to Work, a decrease of 250,000 for both revenue and expense, and the Rapid Response revenue expense decrease of 325,000. We did increase our IM consortium with Racine 400,000, and you'll see the revenue offset of 400,000 as well, closer to actuals. The new building rent is an increase of just under 49,000 for DWD. That would be all the main items under this division. Any questions on workforce development?
I have a question, just overall with the medical insurance increase, because I'm seeing that obviously on every budget. What's the driving factor behind that? I mean, I know it always goes up, but it seems like it is going up significantly.
So the increase actually is only 1%, and the last 3 years it's been the same. So this is the
okay.
first time they're actually increasing it. And I do believe they're expecting a deficit in 2025, so sure it's to offset and keep that reserves up.
Okay, thank you.
Any other questions? For Tammy on Division of Workforce Development? Okay, I have a motion to approve by Supervisor Poole. Do I have a second? Second by Supervisor Kirby. Yep.
I didn't say anything. So I was-
Sure you want to say anything? Oh, Supervisor Nez. Okay. YIG students, how do you vote? Committee? Aye. Human Services Board, how do you vote? Aye. Okay, motion carries.
All right, the next area is our central services, page 10. So this area is twofold. One is the job center, or social services. That'll be the new location. And then the other one is the county-wide postage mailroom area, and that part is the levy portion of this. I did, the 20,000, I did have that as old from last year, description. It's actually postage, so we increased the postage expense by 20,000. And then, in this budget, we did, put in for 3% increases for our providers. So the provider increase for 3% in the mailroom was 2,300. Questions on central services?
Question here.
Supervisor Poole?
So the county doesn't do its own mail services. We have a contractor do that.
We, yes, we contract for Goodwill, to have an employee that staffs down in the, downtown mailroom.
Thank you very much.
Any other questions? No, anybody? Okay, do I have a motion? Okay, a motion by Supervisor Poole, a second by Supervisor Robinson. Youth and Governance? Committee? Aye. Human Services Board? Okay, motion carries.
All right, the next division is the Officer of the Medical Examiner, page 11. For this division, we are looking for a decrease of just under 18,000 or 2.86%. We do have an increase in autopsies. So our autopsies that we are budgeting for 2026, we're increasing from 130 to 136. And that fee also will be increased from Milwaukee, from 1,800 to 1,850 per autopsy.
Question.
Supervisor Poole?
I thought drug deaths were going down, so I would expect the autopsies to be declining as well.
Drug deaths are only a small part of the autopsies that are done. It's based off our projections of where we see that number this year and projecting that into next year. It's kind of hard to, as Patty always say, project death, but it's just the normal cycle of what happens in our community.
Thank you.
Were you done, Tammy?
Yes.
Oh, okay, I didn't know. Any other questions for Office of Medical Examiner? Okay, motion to approve Supervisor Poole, second by Supervisor Robinson. Youth and Governance? Committee? Aye. Human Services Board? Aye. Okay, motion carries.
All right, the next division is the Division of Veteran Services. For this division, we are looking for an increase of a little over 17,000 or 3.3%. In here, the staff recruitment and retention is an increase of 17,000. And the building rent was an increase of 16,000. Any questions on veteran services?
Supervisor, okay, go ahead.
Oh, so
Kirby.
I'm noticing there's a well, it looks like there's a negative number for the medical insurance increase. Is that because of the mix of the employees in the department?
Yeah, so somebody might have either doesn't have it or went from family to single.
Okay, thank you.
Okay, we have a motion on the floor, Supervisor Robinson, to wait second by Supervisor Kirby. Youth and Governance Committee, aye. The Human Services Board, aye. Motion carries.
All right, the next division is our Division of Health Services, found on page 13. For the Division of Health Services, we are looking for a levy increase of just under 270,000 or 13.2%. We have a couple of FTE reclasses. We have a reclass of an admin assistant senior to a HUD project coordinator, an E7 to an E9. A reclass of a public health supervisor, E10 to a grant development communication manager, E10. Removal of a defunded nurse, negative 0.6, and a reclass of a population health manager, E11, to deputy director health services, E13, and then that deputy director is defunded. For funding changes, we have a public health infrastructure grant that we will be drawing down the rest of it in 2026. That is a decrease of 186,000. As well as the SAMHSA funding that we had has ended in September of this year. That's a decrease of just under 480,000. The public health infrastructure grant includes 2.0 FTEs that have been defunded, and the SAMHSA grant included 3.0 FTEs that have been defunded. The other thing to note in health is the city contribution phase out. So every year that will add 100,000 to the levy. 2026 is the fourth year. So we'll have 3 more years, and then in 2030, it will be out of the budget.
Will that rate or that amount stay constant for the next 3 years, the phase out?
100,000 each year.
Okay.
Yep. And then their building rent was an increase of 165,000. This budget was approved by the Board of Health unanimously on October 14th, 2025. And I'll entertain any questions.
Well, you mentioned that several FTEs were done away with largely because of these grants were expired or not renewed or whatever the case may be, right?
Yes, so any positions that we increase when we have grant funding, when the grant goes away, the positions go away with it.
Yeah, so they're temporary, or at least temporary insofar as however long the grant lasts. Okay.
Correct.
Thank you. Other questions? I have a motion by Supervisor Robinson. Do I have a second? Second by Supervisor Kirby. Youth and Governance Committee? Aye. Human Services Board? Aye. Motion carries. Thank you.
Okay, the next division we have is the Division of Aging and Disability. For this division, we are looking for a levy increase of 103,000 or 12.3%. In here, we have funding changes. We reduced the Medicaid funding 150,000. That's really based on projections on where we were at the time.
When you say you reduced it,
We
it's not
being
because the
fiscal.
federal government. Yeah, you got into the checkbook and just, yeah. No, what do you mean? That's not because I know because the situation right in the federal government now, the Medicaid funding is backloaded. And so those cuts we're not going to see those till 2026, right? So
Yeah.
when you say we cut it, can you explain what?
It really based on actuals. They have some changes in what we're drawing down for the resource center. And we're seeing lower costs in there. So we brought it down based on where our actuals were.
Okay, thank you.
The other thing to note in here is we have targeted case management. That's a new funding source starting in 2026. So the adult protective services, we are able to draw down some Medicaid funding for that. So we have 20,000 in there. And we'll see where that actually lands. And then the independent living pilot program that we used to have, that has ended. That ended in June 30th of this year. So that's a reduction of 145,000, both in revenue and expense. The other thing we changed in this division is they have a couple of trust balances. We are no longer budgeting. We will just be carrying over any balance we have with carryover in April. So that's a reduction of revenue and expense of just over $500,000.
What is it? What were these trust balances?
So the majority of that is a transportation trust account that we have from the transportation funding that we can use to buy like buses, capital items, anything that we don't use, we can carry over. There's a certain amount we can carry over, and then we just have it on the balance
Is that
sheet.
just carried over to the general fund or?
No, we hold it on our balance sheet
Okay.
for when we have capital needs. Mostly buses, transportation buses.
Okay, thanks.
This budget was approved unanimously by the Commission on Aging and Disability, October 13th, 2025. And I will entertain any questions.
Questions? Aging and Disability Services. Oh, yes, JIG student. You gotta speak into the mic or speak really loud.
For the medical one, you said that when a grant ends, the position goes with it. So for the living or independent living support program, is that what happened there too? The grant or the funds for that ended and the program went along with it?
Yes, so for this program, it was a pilot program, so we knew it was very short. We actually contracted out, so it wasn't a Kenosha County employee that handled this grant. We actually contracted with, I believe PSG to handle those services and knowing that it was going to end.
Okay, thanks.
Question? Any other questions? Okay, have a motion. Supervisor Robinson, do I have a second? Second by Supervisor Brown. JIG students? How do you vote? Aye. Committee? Aye. Human Services Board? Aye. Okay, motion carries.
Okay, then we have the Division of Behavioral Health Services, page 15. For this division, we are looking for a decrease in levy of 926,000 or 20.92%. In this budget, we have the reduction of a 1.0 for an administrative assistant. And then we have funding changes. We have the Pleasant Prairie Embedded Social Worker. So that's an additional 1.0 and funding coming from Pleasant Prairie. We have the opioid fatality response. It's actually not new funding. It's a transfer from health. The All Rise grant, we have a decrease in revenue and expense of 173,000. The treatment alternatives and diversion grant, we have an increase of 83,000, just under 84,000 in revenue, a decrease of 156,000 in expense for the match. And then the biggest thing that this program did was remove the comprehensive alcohol and drug treatment program. There's a reduction of revenue of 109,000 and a reduction in expense of 477,000. We did add a bucket for non-Medicaid eligible behavioral health service chart coverage to replace the comprehensive alcohol and drug treatment program of 200,000. We did add in 2025 a Vital Strategies grant. That does have a match that's coming out of the opioid settlement fees. So you'll see an additional 1.0 for that position. And then on the next page, we have the behavioral health placements. So we are looking for a decrease in the placement budget of 770,000. We've got the state institutes. We reduced the average days of care from 2,050 to 1,370. So that's a decrease of 656,000.
Yeah. How does that exactly work when you say you reduce the days? I mean, I know what it means literally, but what's motivating that, or what's the?
The actual days. So at the time we budget, we look at where our actual days are through the year. So usually we're looking in April, and then we project out for.
Yeah.
But we're seeing.
Oh, something's going on.
Hearing okay?
Yeah, you're going in and out.
I don't know. Probably a battery.
Yeah.
So based on where we were trending at the time we put the budget together, we were seeing decreased beds in the state institute.
So you're projecting that there will be fewer days.
Yes, but as you see, the Lake Behavioral days has increased. So it could
Because
be
we're using Lake Behavioral more.
correct.
Right.
So
And it's less expensive, right?
correct, yeah. So there we had for 2025, 290 days, and we're increasing that to 476 days.
Makes
And-
sense. Yeah.
And then the care center, they've got the 3% provider increase. And then our residential facilities, the rates are a lot lower than what we had in the budget based on actuals, and that's based on level of care, and we did put a 3% increase in there as well.
Question, yeah, Supervisor Kirby.
So I have a question about the, treatment alternatives, sorry, so they're removing the comprehensive alcohol and drug treatment program. Is that being replaced by the treatment alternatives and diversion and the, non-Medicaid eligible behavioral health services? Or what's driving that?
So the program that we're eliminating has been in place since 2016 and was one of the first MAT programs in our community. Since that point in time, there are a number of other alternatives for people to seek out treatment. And this program just kind of reached its maturity and was ready to move on. So we're going to take some of that money and put it aside in the $200,000 pot for folks who don't have access, either their insurance is denying them treatment or they don't have access to insurance for whatever reason, and help fund their treatment through that. So that's the plan.
So basically, are you saying it's redundant compared to what we?
Correct.
Okay.
Correct.
Any other questions, committee or the board?
Yep.
Anybody?
I
Yeah,
have two.
Supervisor Brown.
Number one, what's the all rise? Why is that?
Well, we'll have Carrie
Supervisor
answer
Brown.
that.
All rise is the,
I know what it is. I'm sorry. Just why is it showing such a decrease?
It's only goes 3/4 of the year. This program ends in September and doesn't go the whole year.
okay, thank you. That was one. And then the intoxicated driver program, what does that change or?
Do you want to talk about that, Carrie?
We're taking the funds that we get from the intoxicated driver for treatment and we're leaving it earmarked specifically for those who may not have insurance that are on intoxicated driver plans that require this for treatment.
Thank you.
Any other questions? Yes.
Hi, I've got on page 197 in the actual budget that was given out. There's an organizational chart. What do those colors mean?
I am not sure. Patty, do you know what the colors mean in that? No.
Don't they just distinguish the director from other levels of management or employees? That's what,
Have there been any changes to this organizational chart?
No, I don't believe there have been any changes to behavioral health, org chart. I think they just added some kind of color scheme in there, but I'm not positive on what that color scheme was.
Because I thought I remember this board being asked to remove the manager behavioral health services person in April.
There's nothing I'm aware of,
Resolution 101.
nothing that I'm aware of.
That's interesting because I asked questions about it back then, but
Clara, can you answer that question, please? It shows for reporting, you said? Can you come up here? I can barely hear you. My ears at my age, and especially so, yeah.
The color scheme, I believe, is just illustrating the reporting structure. So the manager of behavioral health services has direct reports. That's why that's a different color. And then there are other people that report directly to the director.
Got it.
Is that helpful?
well, that kind of answers the color question, but the position question, I'm still not sure what went on.
Did you hear his question? He's
No, I
concerned
don't.
about the position.
The manager behavioral health services, I thought we removed that position for resolution 101 in April.
I'm wondering if you're thinking of when we separated the
Yeah.
two divisions. So then we had a director of behavioral health services and a promotion up to the manager role when that manager was turned into the director.
Yeah, but it said the health manager position was eliminated.
Are you thinking of health?
I think there might be thinking of public health, not
Yeah.
behavioral health, because there's never been, and the split of the divisions was not last April. That was that was 2 years ago now.
Okay, well, I'm just going by what I saw in the resolution 101. I'll look into that more, but I'll pursue it later. Thank you.
Okay,
Move to approve.
okay, we have a motion on the floor to approve. Do I have a second?
Second.
Second by Supervisor Nez. Youth and Governance, how do you vote? Committee? Aye. Human Services Board? Aye. Resolution passes. Oh, yes, sorry, Supervisor Brown. I think that's it, am I not? Is he correct? Committee members' reports. We'll move on to that. Are there any comments by committee members that anything they'd like to say? Supervisor.
I just want to say that, you know, having read through the 100 and whatever pages this was in our budget book, having the summary here was really helpful because I've got all the Post-it notes, but it was really nice to kind of have everything summarized with what's happening to the levy. So thank you for this additional packet.
Yeah, absolutely. It was very good budget. Very little to complain about. Yes, Human Services Board, Mr. Willoughby and Ms. Carr. Go ahead. Okay,
Yes,
go ahead, sir.
on the fact of the veterans groups and their budget, it doesn't look on paper like they do an awful lot, but on behalf of the Kenosha area Vietnam veterans and the American Legion, of which I'm quite involved in, we used to during budget talk about the impact of their service to the veterans in Kenosha County, which But with their help, veterans are able to get the proper disability benefits or educational benefits, whatever, what have you. And that was calculated to be, I think, in excess of the $500,000 that would be generated for Kenosha County veterans to use, in daily living and stuff. So I would encourage that anybody that does do these budgets that kind of look behind the obvious, and what sometimes you see isn't exactly what is going on. I've been sitting in this meeting for 30 years, and it was good to see the downward savings without compromising the people that receive the benefits of all of the different divisions. So I would commend John and his organization that that was nice to see that this year, that we're not arguing over how much more we're going to spend. So thank you.
Thank you for your comment, sir. Ms. Carr, did you have no? Okay. Anybody else? Any other comments? Okay, I have a motion to adjourn by Supervisor Brown. Second by Supervisor Robinson. Youth and Governance, do you want to leave? Committee? Aye. Human Services Board? Aye. Okay, we are adjourned.